Good morning, everyone, and welcome. My name's Neil Walker. I'm the project manager for the York YASDP Partnership. It's my pleasure to welcome you here this morning. I apologize for the slight delay in our start time. Apparently, all the traffic woes that can happen on Wednesday mornings in the rain. So people are still attempting to get here, but we're going to begin now. Wendy Nelson, the new director for the Central Region of the Ministry of Children and Youth and Services and the Ministry of Community and Social Services, was intending to be here to welcome you and congratulate the York YASDP Partnership on our work. She is unfortunately stranded in the US, in Minneapolis, because of the weather down there. She can't get a flight out, or couldn't get a flight out last night. So unfortunately, she's not able to be with us, but we're very pleased to have Greg Ladica to represent her office in the ministry with a few words of welcome. Greg?
I hope that my director isn't stranded by a snowstorm, and even I hope that my director isn't stranded by the snowstorm, and more so that it's not coming here, the snowstorm, not the director. My name is Greg Ladica, and I'm a program supervisor with the Central Regional Office of the Ministry of Children and Youth Services. And it gives me a great pleasure to greet you at the York Region Autism Spectrum Disorder Summit. We are here because we all have a common goal, namely to improve the system of care for children with autism, to ensure they are accepted within our community and to enable them to fulfill their potential. I especially acknowledge many parents of children with autism who volunteer on many regional committees, sharing with us their experience and perspectives, which are invaluable in our efforts to improve the system of service delivery for children with ASD. Thank you for your contribution. And thank you to the members and organizations associated with the York Region ASD Partnership for their years of hard work to improve access and service delivery to families and children with ASD. From my perspective, the only collective effort of families, from my perspective, only the collective effort of families, children's service providers, school boards, and various levels of government can lead to achieving the desired outcomes. I support and endorse your goal of collectively shifting the children's ASD service delivery system in particular, and the children's service delivery system in general, to a more integrated model. The work you have been doing will help the ministry to better understand the community's needs and inform our future decisions on how we invest the public money and allocate the scarce resources. I would like to thank, in particular, Sylvia Pivko, Executive Director of Blue Hills Child and Family Center, for her lead role within the ASD Partnership, York ASD Partnership, and Neil Walker, the organizer of this wonderful event. And I wish you all a productive and rewarding day. Thank you.
Thank you, Greg. And it is wonderful to have the ongoing support of the ministry and the ongoing participation at the York YASDP Partnership table of our ministry representatives. And on that note, I'd also like to thank the ministry for their financial support towards making this day happen, with funds to help with the costs of this event, and also to document the model of community systems change that the York YASDP Partnership has developed over the past 6 years, and you're going to hear a little bit more about that this afternoon. in your midst today, you have lots of great networking opportunities. You have representatives from Early Intervention, from Autism Ontario, from Seneca College, both professors and students, from Community Living Newmarket Aurora. Thank you for being here. We're so glad to have you join us, as well as Community Living York South, Christian Horizons, Kinark, Carey's Place Autism Services. Both school boards are represented, RENA, and One-to-One Therapy, Zorenu. We also have 65 parents and people with ASD here in the audience, so we're thrilled that you're here to help us with this important planning. My task this morning is to introduce you to the York ASD Partnership and our accomplishments to date, and to do so in less than 30 minutes. So I'm going to do that by first playing a video that the partnership made for our launch. And the video outlines what was then our plans and hopes and dreams for improving the system of supports for people with ASD and their families in York Region. And then I'll update you with what we've accomplished to date, and it's quite remarkable.
So my name is Sylvia Pivko, and I'm the Executive Director of Blue Hills Child and Family Center. I'm also the chair of the ASD Partnership and have been very proud to hold that role since the beginning.
My name is Cindy Buick, and I'm the parent of a teenager. I have a 17-year-old son with autism.
My name is Linda Beadham, and I'm mother to Eric, a 29-year-old living in York Region with autism.
My name is Neil Walker. I'm the project manager for the York ASD Partnership, and I've been contracted to help the partnership implement their strategic plan.
I'm Tracy Mansell, and I'm from Carey's Place Autism Services, and my position is a director for Central East Region, which includes York Region, and my focus is on our community outreach.
My name is Jackie Buchanan. I am the parent of a 19-year-old son with autism.
My name is Barbara Duncan. I'm principal on assignment of student services with the York Region District School Board.
So I'm Umberto Chilupica. I'm a pediatrician who works in the Developmental Assessment and Consultation Services Clinic, which is one of the clinics that is part of the Children's Treatment Network of Simcoe Europe.
How did the York ASD Partnership come to be? What challenges exist in York Region that prompted the need for the York ASD Partnership?
Back in very early 2006, our alarm bells were sounded by both boards of education as well as many service providers. In fact, at that time, they identified the need or a gap for children with dual diagnosis, developmental delay and mental health, and also for children on the spectrum. They both kind of emerged at the same time. And parents as well had reached frustration levels in terms of being able to access the service system.
Over the years, we've had challenges, and I've been frustrated with some parts of the system where there's been no centralized information source or navigation, gaps in services, service eligibility. That definition sort of is a moving target sometimes, and sometimes you get service and sometimes you don't.
In some cases, we were actually denied access to services due to their criteria.
So we really needed, as families, to find a way of getting consistent, clear, accurate information as to what to do next. So the York ASD Partnership actually came to be at a moment in time in early 2006 when many service providers, and in particular both boards of education in York, suddenly identified the need that they weren't able to access the right services for the students and for the children and youth that were being served by other agencies. It was like a tipping point. It kind of, everybody recognized the gap all at once.
I've been in a parent volunteer organization for over 10 years, and I know in my time in that role, I've been active in community partnership tables, and I think what was happening was that there were different community tables or committees that were working sort of simultaneously on things, and we needed to all come together and look at big picture.
We were fortunate to hire a consultant, Susan Taylor Simpson from ProAct Ideas, who facilitated us in creating the strategic plan that we're working on now. And part of that process included 2 community days where we invited as many community members and stakeholders to give us feedback around their experience serving children, youth, and adults on the spectrum, and also many families who had numerous challenges in accessing services for their children. We're very fortunate to have over 20 organizations participating, as I said, in this incredible way, along with many parents who have made an incredible commitment to attend multiple meetings on a consistent basis.
The partnership currently has about 60 individuals who are part of the partnership working on a variety of working groups in addressing the mandates of our partnership. But that number certainly is growing on a day-by-day basis.
What will look different in the future as a result of the work of the York ASD Partnership?
I think the greatest hope is that we will have a system that can respond knowledgeably to families and individuals with an autism spectrum disorder when they need supports and services in the York region.
What I'm hoping to see is that the individuals will have services based on their needs and not on a one-size-fits-all approach. That it will be, families will be more included in the services that are being offered to the individuals, will be part of the team.
Well, individuals with ASD should be able to access those services with greater ease and with greater speed. By working in a collaborative partnership, what we've opened up is greater communication between the services. And when you've got that greater communication, you have the opportunities to create a more coordinated level of service for our individuals with ASD. And when you have coordinated services, then the transition between those services will be enhanced as well.
As a result of the ASD partnership, the whole service system will look totally different. And if I can help people understand that this is charting the course not just for services for children, youth, and adults on the spectrum, but also because we're doing systems change, it's going to impact on other services like children's services, for example. If we're going to coordinate access for children, youth, and adults on the spectrum, once we've experienced that ability to do so, it's minutes away from doing that for the children's sector as well. So the work of the ASD partnership is groundbreaking in and of itself for its own population that it's focused on, but it will have ripple effects on every other service system that works with children and youth and adults.
Why is it important for you to be part of this initiative?
So I work in a children's mental health center that traditionally hasn't had the tools or the information to really work effectively with families that have children and youth on the spectrum. Many of those children and youth have mental health problems and issues, and we haven't been able to serve them well. So my hope is, as a result of this initiative, my agency staff will be better trained, better informed, and we will be able to serve many more children and youth on the spectrum than we currently are.
So CTN's philosophy is one of partnership and collaboration. CTN is the Children's Treatment Network, and its goal was to try and coordinate services for children that have physical or developmental needs in York Region. And in our role as the diagnostic clinic, we are often the point of contact for families when they are receiving their diagnosis for the first time. So it's a pivotal point for families, and we want to be able to get families started on a strong footing in terms of the next steps for themselves and their children. And so having clearer connections between service providers and having a better understood pathway for all involved will help parents navigate the system once they receive their diagnosis.
Carey's Place Autism Services is the largest agency in Canada that provides supports and services to people on the spectrum of autism. So it's very important for us. We've already recognized that there's no way that Carey's Place can do everything for everybody who have a diagnosis on the spectrum, so it's made our work stronger when we have the ability to do collaboration and work with partners.
Because I'm a parent of a teenager and we've been in the system for 15 years, so I've got some experience in knowing the kinds of things that did work and didn't work and perhaps why. So I think the parent voice is really important as part of this process, and parents are really encouraged by the fact that we've been included in the partnership work and the changes that will be happening in York Region.
What is unique about this partnership?
So what I think is really unique about this group and what they're trying to accomplish is that it's been a grassroots development. It hasn't been something that government has handed down to them and asked them to implement.
It was community coming together. It wasn't a mandated change.
This is the first and only initiative that I've experienced where there has been 100% commitment from all of the participating organizations.
They've committed an enormous amount of time to planning these system changes. They've committed dollars to making it happen. And they've signed letters of agreement that whatever this group comes up with as the plan for improving the system of supports for people with ASD in York Region, they will implement it and abide by it.
Also, this initiative has included parents in a fundamental way.
Parents are actually a part of the process, and that we aren't just an afterthought, and that our concerns and our issues are actually being considered and addressed.
To my knowledge, York Region is the only area in the province of Ontario where all of the service provider agencies, plus ministries, plus families are working together to implement change.
So we're not just talking about developmental services, we're not just talking about mental health services, or we're not just talking about education. We have everybody sitting at the table.
And it's something that I don't think has happened just quite like this anywhere else in the world. So it's exciting that we're really we're breaking new ground in this kind of development, and it'll be exciting to see how, as the plan develops and the changes turn into reality, what that does for the system of community supports.
How will the changes being designed by the York ASD Partnership make a difference for you?
Prior to becoming involved with the Children's Treatment Network and now the York ASD Partnership, much of what I was doing was quite siloed. I would work independently in my office and not have a lot of interaction or communication with the other community service agencies and the other partners in the system. Being part of the York ASD Partnership is exciting because it offers an opportunity for me to benefit from working with other clinicians with different backgrounds. It also gives me an opportunity to impart my knowledge to other providers. And for families, I think that this will be an important step towards streamlining services that are available to them, increasing capacity in the system, and making it easier for families to navigate the system.
I think what the partnership is planning will make a difference for families in that they're not going to be as frustrated trying to access services, trying to figure out what services are available to them, and they're not going to be as frustrated having to repeat their stories over and over again to every service provider that they approach. I think for the service providers, it's going to mean a lot more communication with one another. They'll be a lot clearer about what each of them is providing for each individual family. And part of the plan is to introduce an electronic record and a single plan of care so that every agency's service component will be recorded for every agency to be able to access and be clear on what that family's needs are and what component of those needs they're meeting.
I'm thinking that bottom line, we'll feel better supported as a family, and we can just be like a regular family. That's really what it means for me.
Just close it. Press escape. Just press escape. There you go.
So my name is Sil.
All right. Technologically impaired, I'm afraid. So what of all those hopes and plans and dreams have become reality? It's quite remarkable. We have implemented a new system of coordinated access. To facilitate that, we completed front door training for over 160 intake workers and referral coordinators in York Region. That training included an introduction to what autism spectrum disorders are, evidence-based ASD practice, mental health and ASD, ASD sensitivity, the no wrong door approach to service access, an overview of ASD acronyms. This field is full of them, as you know. An overview of crisis response services in York Region, the shared electronic record, and service navigation. We've established that no wrong door access system, where any door that a family approaches will get them to the correct service and help that they need. That was facilitated by the development of our access map, which identifies 4 gateway agencies. It took a year of work to bring the list from 22 down to 4 and simplify that process for families. We implemented a warm transfer protocol to ensure that families are not sent away from their initial phone call with a bunch of more phone numbers to call and try and find the connections themselves. We're committed to the use of the CTN Children's Treatment Network Shared Electronic Record for Children. We're maintaining and sustaining the level of ASD knowledge that we've developed through online training modules, and I believe you'll be able to see some samples of these at the professional development display table this afternoon. We've established a partnership with York Region 211, and we've helped them to develop a searchable electronic ASD service database. We've created a Red Flags for School-Aged Children screening tool. We created the York ASD Partnership website and Facebook for regular public communications. The work of the York ASD Partnership has caught the attention of all levels of government, from our local governments all the way up to the Federal Department of Health. We've accomplished autism awareness and media coverage. We've presented our work at several conferences. This year we will be delivering training on ASD and the overlap with mental health to mental health professionals across York Region, thanks to a second grant from Autism Speaks Canada. We're sending access maps to every physician in York Region to facilitate easier access to the correct gateway agencies when a family sees their doctor or receives a diagnosis. We're establishing protocols for consistent screening and assessment, protocols for best practices in transition planning that will be distributed across the region. We're establishing a community ASD training record online. We're measuring the impact of that coordinated access system that we implemented in April of 2013 through parent surveys. And we have a whole lot more to come. Adult services, single plans of care, crisis supports, which is where we need your input later today, later this morning in fact. So how do we do all this? We currently have 9 working groups. The partnership itself is about streamlining access, coordinating services, understanding those services, and understanding autism spectrum disorder. The assessment and screening work group is all about the use of universal tools, understanding the spectrum of ASD, using holistic screening and assessment protocols. The communications work group promotes autism awareness and acceptance, maintains public visibility and inspiration through outreach, and facilitating intersecting relationships in support of ASD. The Mapping and Pathways work group their work is almost complete. The access map and the establishment of the 211 searchable database will both soon be fully operational. The physician support work group is about engaging physicians, educating about referrals for support and services, and facilitating early identification. The professional development work group has been financially supported by Autism Speaks Canada with 2 grants for the provision of training for the intake and referral coordinators, as I said, and for the mental health professionals to help build autism knowledge. The transition planning work group has created tools for planning for transitions across the lifespan, for making good choices, and coping with life's changes. The Adult Supports and Services Work Group is striving for lifelong independence, accessing needed adult services, figuring out how to fill the gaps in service for adults, and making good transitions to adulthood. And all of these work groups report back to another one called the Systems Change Work Group. As their plans are ready for system-wide discussion, the Systems Change Work Group stages the transformation and applies the change within our logic model, which you can see on the display in the hallway later on. So that is what we do, and that's how we do it. It's an amazingly committed group of people who have put years and years and years of work into improving that system of supports for people with ASD and their families. Now, this summit is maintaining our focus on improving children's ASD services in York, and it's beginning our focus on adult services and supports access.